whenever you deploy, you grow a new family. It's those people that you're there with. Those are the people who you're bouncing ideas off of and you're growing with. And similarly, your spouse or your children or whoever at home are also getting a new lens. You know, their lens is becoming affected by all the people that they're surrounded by. So when you're finally reunited, you have two entirely different lenses, and you maybe still have those same backgrounds that you had initially. You still have the all the things that you initially had in common, but now you have a year gap.
You bring a lot of baggage home. That spouse is like, this isn't the person that I married and wanted to be with. And I mean, that person's totally changed because either they've witnessed a buddy dying or a little kid dying, and it's totally changed them, and it makes it hard, and it drives a huge wedge because the spouse here didn't see it, and they don't really understand it to the full extent. It puts a big burden, and I know some it's pushed them to the point where they have committed suicide.
Being part of the military means you are part of a unique culture, speak a unique language, and experience a unique way of life. Whether veteran, service member, or family member, being part of a military family brings a wealth of experiences and opportunities. But along with these experiences come certain challenges and stressors. Stressors like deployment. As service members return from deployments to places like Iraq, Afghanistan, and other places far from home, they face a different challenge, that of integrating back into the family and civilian life.
And I think that's a misnomer, a myth, a misconception that we see quite often, especially in the media, that our soldiers and our service members are all falling to pieces. And those people, though, can still benefit from some help. So, you know, whether it's the pastor or a doctor or a mental health provider who can help them walk through some of those adjustment issues that all of us face. The other piece of the equation are the people that definitely develop some mental health conditions.
The issues that we tend to see more often are service members having issues with reintegration, primarily around post-traumatic stress, anxiety, and depression.
That's where STAR Behavioral Health Providers, or SBHP, comes in. SBHP is an emerging program that makes it possible for community-embedded behavioral health providers to help ease the transitions from lives of deployment and military service to post-deployment experiences. SBHP serves all military, including veterans, active duty, and those in our reserve forces, including the National Guard.
I think it's hugely important for us to partner with our communities. And those communities are going to be the individual providers that are going to be able to care for our Guard members. We don't have those kinds of assets in the National Guard. Onesies and twosies in states and territories, but nothing like what our community providers could do for our Guard members.
In 2010, the Indiana National Guard joined forces with the Military Family Research Institute at Purdue University, Indiana's Family Social Services Administration, and the Center for Deployment Psychology, located at the Uniformed Services University of the Health Science in Bethesda, Maryland. Together, they created STAR Behavioral Health Providers. The CDP is funded by the Department of Defense to train military and civilian health care professionals to provide high-quality deployment-related behavioral health services to military personnel, veterans, and their families. The CDP is nationally recognized for its education and training workshops for healthcare providers. By 2012, SBHP had spread to states beyond Indiana. The mission? To train community behavioral health clinicians and help them better understand and care for military-connected clients, while providing a system to allow those who need care to find these specially trained providers.
Because a provider who understands the culture of the service member who they will be treating is that much better equipped to be able to serve that service member.
SBHP's searchable registry enables veterans, service members, families, and friends to find an SBHP provider near them from the privacy of their own home. Training for SBHP providers consists of a 3-tiered training program. which includes workshops on the latest in evidence-based treatments to help civilians better treat military and veteran families.
I've learned some about image rehearsal therapy and did a 5-session to 6-session test, really working with some clients, and we were able to help them log their sleep and also consolidate some of that sleep so that instead of sleeping during the day and napping time to time, they have more consolidated sleep at night, which was very effective in helping them have more energy, be more interactive with their families.
SBHP is tailored to different levels of provider expertise. The tiered training system builds on information learned in previous tiers. Tier 1 provides an introduction to military culture and information about the deployment cycle. It's open to mental health providers and community members. Tier 2 provides education about emotional and psychological challenges that may become issues for military service members, veterans, and their families. Tier 3 is open to licensed clinicians who have been accepted into the registry. Each Tier 3 workshop provides training in an evidence-based treatment to address such mental health conditions as PTSD. Only 25 to 40% of service members with psychological health issues seek counseling or therapy. In part, this is because of a sense of stigma associated with having such problems.
We do understand that there is some hesitancy for service members to approach behavioral health, specifically behavioral health providers within the military. I believe that over the last 5 to 10 years that we've come a long way with reducing stigma. And our primary objective is to get service members back to their job.
SBHP aims to serve a wide population. About 22 million military veterans live in communities throughout the United States. As the military downsizes, that number is growing.
A lot of guys that I went in with, we did our 4 years, our 2 tours to Iraq and or Afghanistan, and we got out. It was a long 4 years. Now we're back home. We're with our friends that didn't have the same 4 years in the service that we did. They were off doing their own thing. You know, our families were obviously supportive of us and praying for us, but, you know, in some ways or another, they weren't prepared for us to come home and, you know, rejoin.
I came home and I would have told you that I didn't have any demons. I was just completely normal. And my family told me that I wasn't completely normal. And they said I was bossy and that I was short-tempered. And then everything's just kind of irritating because it's not the way it is when you're deployed, where it's efficient. If you see a problem, you fix that problem.
During the conflicts in Afghanistan and Iraq, more than 2 million children have been separated from a parent due to combat deployments. Sometimes getting professional help is the best option to deal with the depression and anxiety that sometimes affects the kids.
There are also older veterans, like the nearly 8 million who served during the Vietnam War era, whose experiences with deployment and reunion are markedly different than those of today's veterans. For many, their invisible wounds remain.
It was a little different for us. We came home to protesters, and we came home to a little bit less of a welcome than the kids today are. It made us wonder and question, what did we do? What did we do wrong?
SBHP providers are trained to understand veterans' issues, feeling of isolation, and the alienation that comes from the post-deployment reintegration challenges that family may notice first.
A lot of veterans seeking assistance, they have that worry that the person on the other end of the table isn't going to understand them. And that's something that you don't have to worry about with the STAR behavioral health providers.
What we want to do is make sure we give you every tool possible in order to be able to serve our Guard members.
We developed the STAR Behavioral Health Provider Initiative mainly because we saw a need. We are a community embedded organization, and so our soldiers, our service members, airmen, live in the communities where these providers live. And so we saw a need to reach out to those civilian folks in sort of a grassroots kind of way to say, hey, we need your help.
I've really appreciated the quality of all the trainings. I had just a tremendous success with my clients over that because I was able to leave with resources that I could pass on to them immediately.
SBHP is designed to increase community collaboration and create opportunities for local organizations to acknowledge those who have served. Community health groups can send staff to participate in trainings, businesses can contribute space for training venues, and service groups can help provide refreshments. These are just some of the ways that communities can help SBHP remain a high-quality program. But more importantly, these groups help to increase community knowledge, awareness, and skill levels with regard to service members, veterans, and their families.
Easter Seals Crossroads here in Indianapolis is proud to be a supporter of and partner with the STAR Behavioral Health providers. We're pleased to be able to offer our facility and host many of the training workshops offered by the STAR Behavioral Health providers. As a provider of programs and services to our military veterans and their families ourselves, Easter Seals Crossroads recognizes the critical need for well-trained and qualified professionals focusing on specific military culture and behavioral health treatments that meet the needs of our nation's heroes as they reintegrate back into civilian life.
In numerous states around the country, STAR Behavioral Health Providers is making a difference for military and veteran families who have given so much to this country.
I do think it's made a big impact. I do think that having 300 plus providers out there assisting us in a sense in taking care of our service members just makes a huge impact. I'm profoundly grateful for those folks.
STAR Behavioral Health Providers is a real example of a public-private partnership in action. In addition to funds from the Department of Defense, SBHP is supported by not-for-profit and philanthropic organizations, universities, and community-based groups that wish to help service members, veterans, and their families. If you or someone you love could benefit from seeing a specially trained behavioral health specialist, please let us help. If you are a behavioral health specialist, community organization, or business interested in learning more about STAR Behavioral Health Providers, we'd love to hear from you. Contact us online at starproviders.org.
And as community providers, I want to thank you for recognizing and also for being willing to better serve your community